Welcome to Nurses Care Hub. We are so excited to kick off this 2022 season with some further dynamite, fantastic nurses. Not only nurses, but nurse practitioners who do a lot for their local community, their state, as well as the international community. So we want to welcome Dr. Hicks. We also want to welcome Dr. Lawson. We want to welcome you. I am joined with my colleague, Lizette Day, who is also a nurse practitioner. You may or may not know me. I'm Dr. Erin Perez. I'm a palliative and hospice nurse practitioner in San Antonio. So welcome. Happy New Year 2022. This is going to be another, I suspect, a roller coaster year, but nurses are resilient. We're fluid, flexible, and we're ready to be innovative and meet those challenges. So I'll introduce Miss Day.
Hi, everyone. Thank you so much, Erin, and welcome to another wonderful webinar series. We're excited for today's speakers, for Dr. Hicks to come in and speak about herself. So Dr. Hicks, if you don't mind just kind of jumping into it, why did you want to become a nurse, or and then give us some background on your nursing education and career?
So sure. So I was really inspired in childhood with my mom. She worked in long-term care and she was an LVN, and she always told us, my sister is also a nurse. She's an RN, and I have cousins that are nurses. So we're just a family of nurses, and my daughter is in social work. But, you know, she always told us to be the best you can be, go as high as you can, whatever it requires in your profession, that is what you do. And I got the pleasure of watching her serve her patients, and they loved her and she loved them. And also her colleagues were very fond of her, and I was very impressed by that. And so she always spurred me to move on and go with, as far as I can. So I went through the whole CNA, LVN, RN, all the way up until, you know how we are. We have the alphabet soup, as they say. But I'm very proud of all my alphabet.
That's the way to do it, I think. Work your way up.
Yeah, I can appreciate every level of nursing.
Yes.
And congratulations, Dr. Hicks, on your FAAN, as well as your own practice. I think let's hear a little bit about kind of your own practice experience, if you would, just briefly for
and then
viewers.
Elaborate on the FAAN. Maybe some of our viewers may not understand the acronym. Do you mind expanding on that too?
So I am a dual fellow. My first fellowship was with the International a Society of Addiction Nursing. So that's the first one. And then my second one, I am a fellow of the American Association of Nurse Practitioners. Not easy to come by, but I love doing the work, and it was very gratifying to have both those honors in addictions nursing and nurse practitioners.
Congratulations. Yeah.
Yes.
Honored to have you here today.
Yes, and we have her here.
To be here.
And then Dr. Hicks, tell us a little bit about your practice as well. I understand that you own your own business.
I do. So I am a clinic owner, very proud to say that. I primarily do behavioral health, but because I'm dual certified, I have the pleasure of serving the primary care needs. I don't follow them. I refer them to my fellow nurse practitioner in the area. She has a family practice as well. And so we have that collaborative relationship. I'm very proud of that. But I primarily do behavioral health, and I'm proud to say we also do COVID vaccinations and testing. So it's not just thinking outside of the box. And being what nurses do, we're very innovative, and like you said, we're very resilient.
Yes, well, thank you so much for all that you've done, not just for your local community, but for Texas, the nation, as well as the international things that you are doing. I think it leads us to our conversation today about COVID and being mindful and aware of the mental health needs. I think COVID oftentimes is looked at as a physical, but then we also forget the emotional and the spiritual aspects of it. And so I think if you can share with us a little bit, I know that you have a presentation for us. Can you share with us your presentation right now?
Sure, and I'll just start out by saying, please excuse my raspy voice. Allergies are hitting me hard this year. But my presentation, and I'll share my screen. Let me get that for you. My presentation today is on emotional intelligence and why it is integral to professionalism. And we know that we are living in chaotic times, we are living through a pandemic, and it's not been easy on us. But this is something that I have leaned to as I navigated through this tumultuous time. It's been very difficult, and I had to find something to help me manage this. And I found that emotional intelligence was very helpful for me. And I'm delighted to share this presentation with you today. So we are going to quick overview. So much information on this topic, but we're going to analyze the 5 characteristics of emotional intelligence and examine ways to utilize and build emotional intelligence to build stronger personal and professional relationships, and also for success and self-care. We're going to discuss emotional intelligence in leadership and highlight the importance of crucial, fierce conversations. So briefly, a history of emotional intelligence. This was a concept introduced by Peter Salovey and Jack Meyer in 1990. They introduced the 4 ability model of Meyer and Salovey, and then Daniel Goleman came along in 1995 and popularized the term emotional intelligence. And he wrote a New York Times bestseller called Emotional Intelligence and Social Intelligence, and Why It Can Matter More Than IQ. And it is now introduced as a theory. So emotional intelligence and our good old limbic system, our rational brain versus our limbic system. We have to have a balance between the two, and sometimes we just don't. And this is where emotional intelligence comes in. It is a balance between our rational and emotional brain. Our emotions are not intelligent. They must be acknowledged, and emotional intelligence can be learned. So what are the 5 elements of emotional intelligence? So self-awareness, knowing yourself, your strengths, your weaknesses, your drives, your core values, and how you impact others is very important. Self-regulation, controlling and redirecting those unhealthy, disruptive impulses and moods. Motivation, what is your why? Your achievement focus. Can you have optimism in the face of failure? Empathy, the ability to see another's perspective, and understanding the emotional makeup of others, knowing and recognizing those verbal and nonverbal cues that people give you. The social skills, building rapport with people to move them in the right direction, very important, both personally and professionally. So who is this person with emotional intelligence? This is someone who never lets their temper get out of control, no matter what problems they're facing. They're calm in a crisis. They have the complete trust of their team. They're easy to talk to, and they make careful, informed decisions. They develop strong relationships, and they have the ability to manage difficult situations calmly and effectively. This person is resilient. Remember that word from earlier from Dr. Perez. They're able to persevere. Another strong word, in the face of adversity. There's someone who is accountable for their actions and willing to put in the work. Here's resilience. This is the capacity to recover quickly from difficulties, that toughness. We had the virus that came on us pretty strongly, unexpected. There was fear, anxiety, family issues, PPE concerns, staff concerns. We worried about our kids in school. We saw so much loss, so many deaths related to the pandemic. Accountability. Where do you stand on that accountability continuum? Are you a victim? Do you blame others? Do you have personal excuses? Do you wait and just hope it gets better? When you blame others, you give up your power to change. I always tell my students, my children, if you have a concern, a problem, an issue, come with a probable solution. That helps to have those crucial and fierce conversations. Don't just complain, come with a probable solution. Be accountable, acknowledge reality, own it, find solutions. When an individual or a department experiences consequences for their performance or actions, that is accountability. Being able to make the changes that need to be made. It's essential and for an organization and for society. And without it, it's difficult to get people to assume ownership of their actions because they believe they'll face no consequences. So we must be accountable for our actions. Perseverance, there's that word again. It's the ability to continue in the course of action, even in the face of difficulty or with little or no prospect of success. And we've seen that these last few years. We had to persevere. We had to be resilient. Excellence is perseverance in the presence of obstacles. So I did a literature review, just looking at some of the literature out there on emotional intelligence and nursing leadership. And some of the major themes I picked out were that emotional intelligence is a charismatic virtue, and it is synonymous with transformational leadership. There is a negative correlation with a laissez-faire leadership. It remediates chronic challenges in nursing, and implementing EI in nursing leadership promotes success. Contemporary healthcare issues require transformational leadership and emotional intelligence. And the emotionally intelligent nurse leader is required to combat increasing turnover and shortage of nursing. The emotionally intelligent nurse leader plays a vital role in diminishing experiential bullying in nursing, and we do know that occurs. Sometimes when we are victims, we victimize others, and we do experience that in nursing. So what are 5 levels of leadership? Respect, the pinnacle. People follow you because of who you are and what you represent. Reproduction, people follow you because of what you have done for them. Results, people follow you because of what you have done for the organization. That relationship, people follow you voluntarily because you've developed those relationships. And rights, just because you're in a management position does not mean you're an effective leader. And even if you aren't in a leadership position, you can lead where you are with these qualities of emotional intelligence. So what are 7 habits of highly effective people? And I picked a few things just so you can realize that how important emotional intelligence is and how we have to implement this every day in life. We have to be proactive, responsibility versus reactivity. Remember your ability to respond. So when you look at responsibility, I want you to look at it differently. Don't just think about the word responsibility, because it is your ability to respond appropriately. We want to be proactive versus reactive. We want to begin with the end in mind. We want to put first things first, think win-win. All parties are committed. Solutions are mutually beneficial. There's reciprocity. We want to understand. We have to first understand before we can be understood. And we really mess up at that, just to put it bluntly. We try to make people understand we try to make people understand our perspective before we understand what they need. And that we have to first understand, then be understood. So that synergy, the empowerment, unifying, creativity, social interactions, sharpen the saw, the principle of balanced self-renewal. Take care of yourself first before you can take care of others. It's just like a car with no gas, it's not going to run for you. So if your cup is half full, you're not going to effectively take care of others. Yeah. So again, we're living in chaotic times. There's the 10 C's. We need to stay calm, compassionate, constructive, challenged, connected, centered, confident, consistent, committed, and convinced that we can persevere, that we are resilient, and we are accountable. Having those crucial and fierce conversations. A crucial conversation is a discussion between 2 or more people where the stakes are high. Opinions may vary and emotions do run strong. And we can do the following. We can avoid them, which is not a good idea, or we can face them and handle them poorly. Again, not a good idea. Or we can face them and handle them well. And I would hope that we would do the latter, which is face them and handle them well. Silence fails. We have to have those fierce conversations, which are conversations where we come out from behind ourselves into the conversation and make it real. We have to think, why would a reasonable, rational, and decent person do what this person is saying, say what this person is saying, or do what this person is doing? It doesn't excuse bad things at all. It just humanizes the person for you so you can deal with your emotions and your own story. It's the opportunity to explore yourself first, again, emotional intelligence, by analyzing possible reasons for the person's behavior. Reflecting on alternative motives allows us to relax, and it opens the dialogue. when you are in that crucial or fierce conversation, you have to stop and think, should this be said? Should this be said right now? And should this be said by me? These are ways to measure emotional intelligence. I personally use mind tools. There are behavior-based tests, competency-based tests, ability-based tests. Psychology Today is a good resource. I'm happy to provide these resources for you. But again, I use mind tools, a 15 question assessment that quickly gives you your level. And according to mine, I am emotionally intelligent because I work on this all the time. So Forbes magazine notes that a post-COVID world requires high emotional intelligence. It's integral to the evolutionary work of diversity, equity, and inclusion. Over the past 10 years, leaders have realized the value of EI in cultivating relationships and managing people. Emotional intelligence, or EI, has become an even more critical capability for all leaders in management at every level in both public and private organizations. And it takes a high level of EI to navigate through difficulties and rapid changes. Again, we are in this, guys, so we have to be emotionally intelligent. So what is success? We have to get to work, keep working, don't stop. That equals success. Thank you so much. And I know this was a fast presentation, but I wanted to get the core concepts to you.
Wow. That was wonderful.
Wonderful. I don't have a comment to start off, but I do have a comment. Our brains are so hardwired to give emotions the upper hand. So I really appreciate the slides about having those crucial, fierce conversations, because I think a lot of us either are silent or stop. But so that's very informative.
Yeah, I love
Thank you, sir.
Dr. Hicks. Wow. That was a comprehensive rundown. I mean, just wow. But I think, right now, living in the time of COVID, we were hopeful for kind of post-COVID, but I think we're all learning a new resilience and innovation of how do we live with COVID as the roller coaster continues. And I love that you touched on emotional intelligence in addition to the diversity, equality, and inclusivity, because I think as we challenge ourselves physically, emotionally, spiritually, having crucial conversations to me is like a never-ending story. I mean, it's constantly with that encounter day in, day out, and even moment to moment, even with your colleague.
And understanding is huge. I know you mentioned that in your slides, but having that understanding for others, for that diversity and inclusion.
Yeah. So I think, Dr. Hicks, what are some ways when we're dealing with COVID, we're dealing with emotional health PPE for our nurses, whether they're LVNs, they're registered nurses, they're APRNs. I look at from the boardroom to the bedside, to the clinics, to the hospital. What are some ways that we can look at as far as how can nurses communicate effectively with those crucial conversations, being mindful of emotional intelligence and remembering to use not just our rational or emotional, but kind of the fusion together. What are your thoughts and something that we can take home?
Well, I think first you have to have a seat at the table.
Yes.
We can talk about things all day long, but if you don't get that seat at the table, you're not going to get anything done. And I think you all have provided a link to the future of nursing, 2020, 2030, charting a path to achieve health equity. You have to, I can tell you, one of the pages, I've gone through this book, page, I want everybody to take note, 278 to 279, it talks about leading self. And it talks about putting yourself in those positions for change. Because again, we can have those conversations, but if we don't have that seat at the table, there's not going to be much done about the issues that we feel most strongly about.
Yeah. How do we get there, Dr. Hicks? How do we get that seat at the table?
So for me, I I study myself to study to show myself approved. It's a constant study. You can't graduate and not study and not put yourself in the place. Take yourself, Dr. Perez, you've gone for city council, and correct me if I don't have that correctly, but those are things that you do. You put yourself in the place, because you're not going to get that opportunity by standing by and hope that someone picks you. You have to put yourself in the place. You have to give yourself the knowledge. You have to become members of your local, state, and national organizations. Become involved. This is how you get that seat at the table.
Even if you're a nurse at the labor and delivery unit, I think just volunteering for positions to help the unit staff with mental health or different team building activities. You start somewhere small and then build up to possibly city council one day.
Well, I love Dr. Hicks. You touched on one of my backbones and my foundation of not just my profession, but also I think for all nurses, we can identify as nurses the problem. But I think sometimes we get overwhelmed with sometimes maybe labile emotional intelligence, so we don't always see the solutions. But I think you brought out in your presentation just wonderful ways, tangible ways to kind of pause, take a step back, actually listen to what your colleague or the person you're engaging with is sharing, so you can understand, and then you can probably, even if you don't have the solution, that'll probably click with the solution as you're listening to them talk. I thought that was, to me, just momentous. And I think the Future of Nursing 2030 built on that report from the Future of Nursing 2020. I think, Dr. Hicks, you are going to be one of our national leaders very soon, not just in Texas, and I look forward to that. What else do you think we can do as far as, we're having to be resilient, having to be innovative. We're starting to have more mobile technologies in regards to
meditation apps, right? Different apps, mobile apps that help with just calming and centering, I feel.
Yeah. What do you think about the mental health as far as mobile technology for nurses to have self-care, self-awareness, and to kind of, I think, keep that resilience of emotional intelligence high by just taking time for themselves with mental health? What are your thoughts on that?
Listen, I can tell you that, and I'm proud to say that my no-show rate was minimal before we had the technology, but now is zero. And I am very happy to say that I have nursing colleagues, all levels, that reach out and say, how do I get through this? And I love that we have the ability to call from our homes or from our car, because I see some of everything. So it's some things I don't want to see, but I'm like, did you?
It happens.
But it's okay, because people need to feel comfortable in these times. Times change. The same boundaries that we have before, we can't have those same boundaries as time continues to evolve and people continue to change, and people want to share their voice, what they're feeling, who they are and who they're not. So as people get more comfortable with that, they need an outlet, and technology is the key for that.
Now I'm going to touch on a very sensitive subject that can be a little bit charged. We know that in the United States, nurse practitioners, advanced practice registered nurses, not always can practice to the fullest extent of their education and training. And as we are becoming more self-aware, we're becoming more innovative. The Future of Nursing 2030 was clear on the role of advanced practice registered nurses to improve healthcare access and quality at an affordable care rate for our communities. Do you think that all states should allow full practice authorities for advanced practice registered nurses? And what are your thoughts on not only why, but how do we get there?
Wow. Oh gosh, where do I start? I'm going to make this succinct. I got this question, my mind just started going. So we know, it's charged conversation, right? And I'm going to be very transparent here, because we are a female dominated profession. And we know that's one of the reasons why we don't have it in every state. But for some reason, we're afraid to say it. And I think we need to just put it out there. We are a female-dominated profession. We do good work. There's no literature to support us having restricted practice at all. If you can show it to me, I'm happy to have that crucial conversation, because that's what we need to do, instead of spewing things about a profession that, if I work very well with my physician colleagues, and when I come in with a confidence, right? Because I tell my students, I said, you have to read every day. You have to stay updated. We can tease apart, how nurses learn and how physicians learn, but we want the same outcome. So I think the restrictions, I just think they should be null and void. I don't think we should have them. And again, I take it back to when we talk about diversity, equity, and inclusion. Yes, race is a big factor, but also being a female-dominated profession. I believe wholeheartedly, just looking at and reading the history of nursing, this is why we have restricted practices in states. We need to really be comfortable in our own skin as women and say, this is what we need and this is why.
Yeah. Thank you, Dr. Hicks. I applaud everything and I concur with everything that you just shared. I think it's oftentimes, I think, as nurse practitioners, mostly women, as well as nurses, mostly women, we look at a different lens, a different perspective of what we bring to that table. And sometimes we're not as assertive as I think in those crucial conversations. I think that sometimes that may impair our seat at the table, or even I can share, sometimes nurses have shared, they even look at, am I ready yet to have that crucial conversation, not even knowing that they're already ready.
Right. I think if you're asking the question, you're ready.
You're ready.
I think you're ready.
You're ready.
You're ready. And
if you're not, you gotta get ready.
Yes. And I think as we progress as a profession, then I think we also have to take stock at us as a whole profession. As we treat patients holistically, we really have to drill down to making sure that we have those crucial conversations, the emotional intelligence, but also we're looking at diversity, equality, inclusivity in our own profession, our own self, our community, because sometimes that is not spoken out. I think it's kind of pushed to the side a lot of times, but I call it like a rebirth, a reawakening of the last probably 2 years. I feel like we're having more eyes open and the awareness. What are your thoughts?
I cannot have this conversation without, I feel it's very unfortunate that we had to have such a significant loss. And when I'm saying the loss, I'm speaking of George Floyd, the visceral feeling of seeing that in real time and, having to deal with that. That is one of the reasons why we have the platform to have these discussions, but it's unfortunate that we have to have such a severe loss many times to even have a conversation. And my goal is to just keep the conversation going in whatever way possible, because sometimes we have these big conversations and this big thing happens and then the conversation kind of dies down and we end up back at square one. So we have to really stay in this moment and progress forward. And that is, yes, keeping it going. We have to, because this pandemic, seeing, his death on television, and I know this is another charged subject, but it just realizes where we are as a nation and how we need to change if we want to look at our goals for 2030 when we're talking about the path to equity, to health equity. Yeah. And health is not only physical health, it's mental health, like you said, Dr. Perez, spiritual health, the ability to be able to thrive. If you bring me to the table, I need to be able to feel that I matter at the table. So there's so many levels to this, and happy to keep the conversation going, but I have to respect everyone's time.
Yes. Well, definitely we need to have that ongoing conversation. Hopefully, maybe Dr. Hicks, you can continue to join us in the near future for ongoing discussion, because I think the challenge is number one, starting the conversation and that awareness, but also like you shared, how do we keep that momentum in the spotlight when things start to die down, or that media coverage is no longer covering that? How do we continue that? Because I think this is not going away. It's only going to continue until we really get to the root of the problem and have those open discussions. Right. To look at solutions
and how to change the conversation, or transform from just conversation to action.
Having those tangible things that we can do.
Well, I appreciate Dr. Hicks, your expertise, your time, your resources, your gifts and talents this morning, and sharing a little bit with us, but also our viewers and our colleagues. Goodness, what a powerhouse you are. And so thank you so very much. Thank you very much. So I think also who is going to join us is Dr. Scharmaine Lawson. And most people know her from her house calls practice, as well as Nola the nurse. Oh my goodness, there is Dr. Lawson. She is, I say, the Dr. Lawson. There's only one Dr. Lawson that everybody knows. She's been on print, radio, TV, you name it. She is well known as a family nurse practitioner, but also psychiatric mental health nurse practitioner, in addition to all that she does, not only for her local community, her state, the national level, and international level. So without further ado, I will share the Dr. Lawson that has joined us this morning to kind of introduce herself to all of us.
First of all, thank you for having me. I have a little confession. I don't have a PowerPoint like Dr. Hicks, so this is like a little fireside chat here. I generally, I tell you, I don't do PowerPoints anymore. I just kind of like to have that warm and fuzzy talk, and so I've just kind of gotten into, let's just talk and let me just be organic. So I hope that works for your audience. So again, thanks for having me. And a little bit about me, intro. I'm just a little girl from New Orleans, who just sort of hit the map after Hurricane Katrina. And I was an RN for X amount of years. I won't go there. And so Katrina hit. I had been in NP already for 4 years. And so once the storm hit, I already had a private practice. And the storm just sort of catapulted my practice into the national level because of the disparity that it left in the wake of the natural disaster Katrina. So from there, things just kind of snowballed into more opportunities, mainly because of my big old mouth, which does serve me well in most cases. You have to learn to channel it in a good way. So, I was able to get a lot of help for the residents in my community. So from there, I got into being an author, then public speaker, then children's book author, then animation, then I mean, it's just, the sky is truly the limit, and I just want to encourage everyone, who's listening, who's watching, that you should not box yourself into thinking that I'm a nurse and oh woe is me, I'm just gonna be at the bedside all of my life. And no, there's so much more to you, and I encourage everyone to exploit their professional roles into the stratosphere, because you can do anything. You can write plays, movies, books about nursing, about health, about science. You can be a part of virtual reality. Last I checked on my Oculus Quest, which I got for Christmas, it's like there are no science games in virtual reality. Why is that? So why can't we do that, right? Who says we just have to, give first aid injections all day, right? So it's just, I think that I'm here to help others learn to exploit the role that they're in professionally, and not just think, no, there's nothing wrong. Nothing wrong with being at the bedside. I was there for X amount of years, and it's like, I'll never say, but
I think we all have to start off there. I think we all have our bearings there.
Absolutely.
And then expand
Absolutely.
into the role.
Absolutely. So yeah, that's my intro, I think, in a nutshell. And so any other questions? Hey Tracy, hey girl, hey, hey, we have a long story. I'll tell you that day. We met in another life.
Well, thank you both for joining us. And Dr. Lawson, can you share a little bit about the future of nursing 2030? I was able to hear you narrate this wonderful podcast series. And then also, if you can share with us a little bit about NOLA, who is very
No.
well known at the international level.
So yeah, so this is I'm gonna try to because I'm gonna be mindful of my time here, but I would just really like to say whoever has not listened to the Future of Nursing podcast, it really should be something that is on your radar because it's if I must say so myself,
Agreed.
it's so well done.
Yes.
There's some really really emotional moments in the podcast when you hear nurses speak of how they were burned out in working on units during COVID and having to take care of patients and just nurse patient ratios. So it some of it, and I'm getting a little emotional now thinking about it because some of it is really very very touching, and I just didn't expect to feel some of the things that I felt while narrating, and even though I wasn't in the room with with all of the other participants on the show, I heard their stories and narrated over it, and it was really emotional. So it really gives a deep look into nurses and what we go through, those who are on the front lines for I was about to say Hurricane Katrina, Lord have mercy, on the front lines of COVID. And so I encourage everyone to, not only read what the recommendations are from NAM, National Academy of Medicine, but also listen to the podcast because the podcast actually brings all of the recommendations to life.
It's
And
powerful.
it really is. And I say it's worth getting an Emmy, really. It's just amazing. Again, hello, I'm a part of it, but still, I think that it was just so well done, and I've not seen anything like that in the podcast world that's like science or medically based, or especially nursing to date. So if you haven't listened to the Future of Nursing, I certainly encourage everyone to
It
do so.
resonates so much,
Yeah.
even still today.
Yeah, it really does. And, because it talks about a lot of things, of course, the, social determinants of health and how they affect, outcomes, patients' outcomes. And so a lot of people, I think, don't really, kind of put those two together, how social determinants of health, and they don't like to say food deserts, but these things, affect
Yes.
quality of life and patient outcomes, but they do. So it really gives deep dive into that. And also you get to hear the people who are on the front lines who are experiencing this with these outcomes and who are experiencing, issues, in the workforce as far as, colorism or, racism or other things that a lot of people don't like to talk about, but they're there and they impact nurses and how they feel. So I think it's very well done, and it's class act. Okay, so that and Nola the nurse. Where do I begin? Oh wow. I all I can say is I promise you, I really just started with writing one book. I said just one little book because I want my daughter to know kind of what mommy does, and because I went searching, Barnes and Noble, went looking online, Amazon, and I didn't see anything that really talked about the role of an advanced practitioner for a child, and so didn't see it, and I says, oh well, as I guess I just have to write, NOLA the nurse. NOLA is the acronym for New Orleans, Louisiana, which is, the setting and where it originated. And so she's 7 and she wants to be a nurse practitioner like her mom because she sees her mom do home visits. I know, very original, right? Her mom's doing home visits, and so she follows her around, and she can't take care of physical people because she's a kid. So what she does is, well, I'm just going to emulate that and take care of baby dolls for my friends in the neighborhood. And so so everything about the character was really strategic in that I want the character and then later characters, in that I wanted Nola to specifically be, African American, because there were not enough children of color represented in Kidlit. And not only that, but I wanted her, as you can see, I'm fair, but I wanted her to be darker so there'd be no mistake that, there's no ambiguity here with her color. She's actually black, and not only is she black, but she has afro, right? And there's also no mistake about her role. She's a nurse, so she has the cap. So for all those people who want me to take the cap off, the cap stays. Okay. So moving right along. I mean, that's a hot thing. If you guys don't know, it's a hot thing. It was on Twitter. It was a while back. Someone was, back and forth with me saying that, why, does she have to wear a cap? Because nurses don't wear caps anymore. Nurses don't wear uniforms anymore. I says, whoa, 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 whoa. Why are we doing this? I mean, and so I find having to defend, why she wears a cap, why she wears the dress. And it's like, instantly I want people to know not only is the, protagonist, she's, dark, African American, but she's a nurse. Boom, cap, dress, it stays. Okay. All right. So moving right along, the other characters, I wanted it to be sort of like a reflection of America, with Maddie the midwife, who's blonde, and we have Bax the nurse, who's also a nurse practitioner in training, and he's of Asian descent. And then the last person we have is Charo the CRNA, and
Yes.
so now, yeah, we've moved into now all of them, trademarked. All of them are now going to be involved eventually on the animated series that we're working on. It's just it's moved into, now we have like 30 books, coloring books. We have the hardcover, we have paperback, we have cursive writing books, and all kinds of activity books and STEM books and all kinds of books, right? And so I say that story, and I give it sort of like lighthearted, but it's not really lighthearted, because, it starts with a dream and an idea, and it was just an idea of just having a nice little story. I just want to read to my daughter every night, and I wish that, there were more kids who wanted to be an advanced practice nurse. And it's just, okay, I'll write this little book, and, there you go. And then it becomes like, wow, you start getting reviews and people are liking it. It's, maybe Nola needs some friends. And what do our friends look like, And so then it becomes a groundswell of, wow, this could now be translated into Spanish and French, which the first volume is. It's like, oh, even though I don't speak Spanish, okay, so it's like, so your dreams really do make room for you, even though you feel as though you don't belong there. You actually do, because you are the one dreaming out loud, and that's what I'd like to encourage everyone to do. Just dream out loud, even though you don't speak the language. That doesn't mean you don't have the right spirit. So the dream starts with the right spirit, right, and that will lead you to greater goals and greater, eventually, which would be patient outcomes, because we'd have a better nurse patient staff ratio, right? So increasing more nurses on the workforce, because kids can't be a nurse practitioner if, first of all, they can't pronounce it. They've never heard of it. They don't know what's going on. It's like, what's going on? Who says certified registered nurse anesthetist? Who says that at 4, right? So it's like, but you have to introduce them. You have to start hearing it, right? They may not be able to say the whole thing, but they can say, oh, CRNA, yeah, CRNA, yeah, midwife, okay, and it's about getting them to start recognizing the terms, and then from there you can start to then bring them more and says, oh yeah, this is what you do, this is what they do. They're viable parts of the medical team as well. And that's what the whole premise behind the Nola the Nurse brand is like introducing children to the world of advanced practice nursing.
And how vital it is to see someone who looks like you on the cover, depicted. So
And diverse too. I was thrilled. I have to say, I was also thrilled when your CRNA Charo came on, because, in San Antonio, it is very challenging in Spanish when I have to introduce myself. We don't really have a nurse practitioner in Espanol. We really have differences in language. There's some changes in language, so a lot of times I'll say, a la enfermera especialista, and then you have
Enfermera práctica.
or because if I say práctica, sometimes they think that's LVN too.
Oh.
So then I have to explain, but thank you for NOLA, as well as being diverse and showing the world what nurses in different specialties and different roles bring to not just them as a person, but them, but also to the family, the community, and then what we bring to the table as far as for their health care. I think of Dr. Hicks earlier sharing, we have to be at the table. And my Dr. Lawson, have you gotten to the table and then some?
And the bed, and, at the bedside, at the dinner table reading.
Yeah. I think you've changed truly the landscape for nurses in a positive way to show all that nurses can be. There's not a limit that NOLA has been set on. And I think it has also brought some comfort. So for parents who are reading this and schools who now have this in their libraries, I think of, does the parents take away some tips from NOLA? What do you think about that? Parents taking away some tips as they're reading.
Yeah, I think that brings us to another point, and another actually idea I had was to definitely have just a book about NOLA talking about the importance of self-care and mindfulness and meditation with kids, and how it makes such a big difference, and how they really need to be introduced to these amazing techniques. And there's research about how one school who stopped playtime, and kids started doing yoga and meditation, and some outcomes about it being behavior changes to the right, being better behavior outcomes. So I think that parents need to be more aware of this, because for some reason a lot of conversations I have with parents is that they weren't aware that there were certain things that kids can do as far as yoga and for as mindfulness, and it's like they can do it, and it's so important, and it works.
Yeah, those techniques, just as you learn as an adult, because I don't think I learned about self-care until I was in my 40s, and knowing that you can teach your children those techniques so they can have those coping skills when they have anxiety or when they feel a little bit sad.
It's all a part of self-soothing. It's like, how do you calm yourself down? If you believe it or not, when you tell your kid, let's count 10, 9, 8, what is that? That's focus. That's really being of right now, this right mind right now, and taking everything away, dial it down, 10, 9, 8. You're helping them practice a form of self-care so they can calm the anxieties, and calm out all of the tantrum they're feeling, and it works for some kids.
Yeah, I think of the more we're aware, even at a young age. Now you're changing that future line for their generations, not just for them, but also how do they teach their family as they continue to grow and change the community and the world that they're in. And it starts with a healthy perspective. I think, of self-care, we're still learning as adults. How do we take a pause time and have actual self-care, not just say, self-care check on your cell phone to-do list, but really taking pause and doing something that is meaningful to your physical, emotional, and your spiritual health, so you can give back to others in a more positive way and meaningful way. And I think of, all that you do, Dr. Lawson. I don't know how you fit everything into your days.
I'm still trying to figure it out.
But what was it like when you started your own house calls as a nurse practitioner in New Orleans? What was that like?
Yeah, so the thing is that I actually started that practice in 2004. And like most entrepreneurs will tell you, is that they didn't just wake up one day and say, oh, I'm Steve Jobs, oh, I'm Elon Musk. Hello, I'm going to, make Tesla $1 billion brand. You don't just start out like that. It starts with a small idea. And so for me, I didn't say, oh yeah, I want to, start this house call practice. It really started with a physician who said, you know what, I have a few patients that I'd like you to see. I'm going to be retiring soon. And so it started with 15 patients, and I started seeing those 15 patients. And once I saw that it was a viable service for the community, I decided to make it official and get the name and then hire some staff. So I didn't just start out saying, oh yeah, I'm going to have this big, house call practice. I just said, you know what? I want to provide additional services in the community. Had always done home health nursing. That was always a part of my nursing bag of specialties, if you will. I always just sort of ventured out into home care because I felt like there's just a certain spirit you have to want to go into someone's home to do home visits. You have to be willing to think outside of the box. You have to be willing to, in some cases, travel with an armed guard. And so I did all that. And I just, either you like that experience and that thrill of not knowing what you're gonna get or sit in someone's home, either you like that or you don't, right? And so I've always been like walking on the wild side, right? So yeah, I'm gonna go, I don't care, let me figure it out later, right? They need help, look, help me, I'm gonna help you, you help me, whatever, so that was always my attitude. And so I don't know, it just grew and grew. And then, like I said, I had Hurricane Katrina to help me get it to blossom. But once it got to be, at its highest, we had, at least 6,000 patients. I did not realize that I was the first nurse practitioner in the state of Louisiana to start a house call practice. I did not realize that. And when someone told me that, and we, did a lot of research just to see if it was actually a fact, it's like, wow, it's a fact. So wow, I'm still alive though. It's kind of like a legend, right? But I'm alive, right? Okay, and I'm still like 25, So it's like, it's one of those things. Whereas it was a great feeling, and even though now we don't really do all those home visits anymore, it's mostly virtual. I do a lot of like telehealth mixed with the telepsych because that really just sort of took off, thanks to another big issue catastrophe, which was the pandemic that we're still currently in. Yep. It's now mostly virtual. So the feeling was great, and I still feel like most people who've done something I guess pretty amazing is that you feel like there's so much more to do. There is, there's still so much more to do, and I feel fortunate. I feel fortunate that I'm still alive and still have, the energy and the willingness to work hard for, continuing to make a difference.
What do you think, Dr. Lawson, from the House Calls 101? I know that our viewers, there is a lot of nurse practitioners, advanced practice nurses that want to start their own house calls or their own business. What do you think as far as advice that our viewers could have that you have learned to go ahead and take that next step and that leap of faith?
Right. Or overcoming those challenges, barriers.
Yes.
When you're kind of at a crossroads, should I not?
So I would say, you're thinking of starting your practice, specifically house calls. Make sure you've done enough research on the area that you want to start in geographically, meaning, who is your competition? Because it'll make a difference if there's another house call provider in the area. If you're going to be the only one, then that's great. But then it may be not so great because you're going to have to do a harder sell to some of the home care agencies and some of the other resource referral sources that you're going to need. But, do your homework, do your research in the area and where you want to start your practice. And, it can go one or two ways. If there is another healthcare or home health house call practice there, then you got some competition. Sometimes competition is good. Maybe not so good. It just depends. But, I always say, little healthy competition is not bad. It can definitely help you stay on your game as far as making sure that you're delivering the quality care. And as we know, nurse practitioners do quality care. We go above and beyond. We do extra, right? And so just make sure that that's something that you're offering, and then make sure that all of your, personnel and everything, you're all on the same page with that same message. Because a lot of times you as the owner may be saying something, but your workers and the people who are on your team are not singing the same song. And nobody likes an off-tune song, right? You guys always have to be singing the same notes, correct, right? So it's like, what? Why is she singing, Star Spangled Banner, and she's singing, like Let It Rip? What's going on? You both have to be singing the Star Spangled Banner, and so on the same key. And the problem is like a lot of times that's often not the case. So get a good team. Don't try to do it all yourself. That's a problem I had initially because I wanted to do it all myself, but I realized that, it's no way I could see 5,000 patients, ever in my life. Would I want to do that? That's not self-care, right? That's like that's killer care, right? So it's like, you got to get help. And it's hard when, and I'm speak especially to alpha women now, it's hard when you're used to always being in control. You're doing it all yourself because it's like, well, it's not going to get done right unless I do it. Well, there comes a time where you just have to say, listen, you know what? I'm going to lay the blueprint, and I'm just going to stand back and watch and see if they're delivering and they are also, doing what the blueprint advises them to do. And if they're not, that's when I'll intervene. But you have to trust, hire and trust that the team that you have picked, because you're involved with the selection process, you've picked the right members for your team, and that they are going to effectively, go out and do the same thing, sing the same song, if you will.
The same mission statement, the importance of a mission statement.
Yeah, same mission. You have to eventually trust that they're going to do that, because if not, you're going to wind up trying to see these patients and you're not going to be effective. And that's not effective leadership. Real leaders train, teach, and then really they trust that the team is going to go out with the mission that you have trained them with.
Well, I think mission and vision, Dr. Lawson, are so important, but I also know sometimes policy and regulations can kind of share boundaries and challenges that advanced practice nurses have. And I know we had talked earlier with Dr. Hicks about some of the challenges that advanced practice nurses have at the United States level. Some states have barriers to practice, even though we know advanced practice nurses have over 50 years of hardcore evidence to support, their practice, their quality, as well as their affordability and their to communities. But I think with some of the CMS changes, some of the state policy changes, what are your thoughts as far as for those advanced practice nurses, whether they're with an employer or they want to be their own employer, kind of navigating those policy and regulation challenges?
So, I get it. We need policy, right? We need regulation. We need that because that keeps us all safe, right? But at the same time, I don't think that it should be really at the cost of great patient outcomes, which is what I think when you start, trying to be heavy hitting with so much regulation, so much, policy. Well, then it becomes like, well, what about patient care? What does that fall when you're drilling regulation as far as, we need a collaborating physician agreement in place before, this doctor can have 2 nurse practitioners, and you guys have 20,000 members out here who are unable to get to the local hospital. But you're fighting overnight every day about regulatory jargon related to what? How many nurse practitioners? Do we need a CPA? So I think a lot of times, people will put this regulatory, whatever jargon in the place of, actual patient outcomes, and not looking at the fact that, what, if we just get away with some of that, and let's do a trial basis, in some of these areas, and particularly the rural areas, rural Georgia, where there's, a severe shortage of healthcare providers. Why don't we do a trial basis of, nurse practitioners, maybe just, for, I don't know, 20 acres, 30 acres, whatever you want to call it. Let them, have that amount of land. Let them have 2 counties, 2 districts, and see, measure outcomes over 2 years, and see, did anybody die?
Right.
I'm just, did what, how many hospitalizations did you have under, nurse practitioner X versus last year when they didn't have a healthcare provider in the area? And let's compare. Let's compare hospitalizations, ER visits, with the year with you had a healthcare nurse practitioner versus the year when you didn't. And let's measure that, since we want to be, all quantitative about things. Let's
Right.
measure that and see, the real difference. And if you notice a difference, if there have been positive outcomes, meaning less hospitalizations, less emergency room visits, then grant the nurse practitioners full practice authority for that area. I think that, this back and forth about, oh, we shouldn't have this, we shouldn't have that, it becomes, just a moot point if patient care is really affected by this. Does that make sense?
Yeah, and what a more perfect time than right now during the pandemic. We're still considered under a
Well,
public health emergency.
And then too, it's like, then what confuses me is that, okay, so we're in a pandemic, so some of the laws now have been relaxed. Nurse practitioners can actually now function to the highest, of their scope of practice, right? Because we're in a pandemic. But then when we're not in a pandemic, we go back to not having the full practice authority. I'm so confused. So then you have to then follow the money and say, whoa, okay, is this because, a lot of the, medical doctors are benefiting from collaborative practice agreements, monetarily? You have to look at all things. I mean, these are subjects a lot of people don't want to talk about, but you have to, follow and trace the money. Why is there so much pushback on nurse practitioners in certain states not to have the full practice authority? Yeah, they may have bigger medical institutions that are lobbying against NPs, but why? That's always been my questions. Like, but why? So
It is there from just the other states who are at full practice authority.
yeah.
correct. So then you have to say, but why? So then it has to be, to me, it has to be a monetary reason.
I think of, Dr. Lawson in Texas, one of our biggest challenges, especially with the pandemic, it was actually made national news that in San Antonio, we had this huge area of various zip codes, of course, that had underprivileged or not accessible, or healthcare costs too much. And we had a higher proportion of people dying from COVID because they just didn't have primary health care and health care to share and improve the health literacy. And I think it shouldn't, there's been legislatures who have shared it shouldn't determine, your health and your longevity based on your zip code, because we don't have providers who can give you that care. In Texas, we have 254 counties. There's not a physician for every county. But there is an advanced practice nurse in every county. And I think when we're looking at, how do we work smarter, not harder, and we have the evidence to prove the policy changes that need to occur, I think now the pandemic has really catapulted, we've got to have appropriate utilization of human capital, the resources that really lead to more appropriate appropriations for those policymakers to substantiate, when you're talking about follow the money. Well, we know the literature shares if the advanced practice nurses have full practice authority, it doesn't mean that we're changing the scope of practice. It means that they're able to do the scope in which their education and training and licensure and certifications allow them to do.
Right.
So I think it's huge, Dr. Lawson, what you shared is there's so many different layers upon layers of these challenges, but I think, overarching, I'm thankful for your participation with the Future of Nursing 2030. That really highlights the full scope of what nurses can do and should be able to do, not just to minimize and say thank you for doing bedside or clinic care, but there is a lot more that all of us as nurses can do. And I think you and Dr. Hicks have highlighted not only how we just do our professional job, and I often sometimes say, we have to stop renting our profession and start owning it. And my goodness, Dr. Lawson, you and Dr. Hicks have done just that.
You own it.
So you all own it. I know you all are going to continue to do remarkable things for us as a profession, but also as you move the needle forward for so many different layers of the United States as well as the international community. Yeah. So I want to just say thank you so much to both of you.
And it's an honor to be at the same table with both of you. And for any of our viewers or new nurses who are burnt out or contemplating, please follow these women on all the social media platforms, because they will give you hope into catapulting your nursing career into totally different directions, from being an author to owning your own business. So thank you all for being such positive role models.
And thank you both, Dr. Lawson and Dr. Hicks, for your care during the pandemic, pre and during right now. I know you all have shared so much today, but I also know it's taken a lot out of both of you and your families as well. So thank you for your service.
Thank you.
Thank you all for having me. Thank you. I appreciate it.
Thank you so much for the opportunity. It's great to be here.
Dr. Hicks, Dr. Lawson, do you all have any final words for our viewers before we let you go?
I'm just happy to be here. Everybody can always email me, Dr. Lawson at drlawsonnp.com. Just send me a message, or what did they say? Slide in my DM. Send me a little. Those young people say slide in my DM.
Slide in my DM.
Send me a message. I'll try to answer. Somebody will answer you. Hopefully within 24 hours.
Well, the important question is, do you all have a TikTok we can follow?
Oh my goodness. I have a TikTok. You can follow it all you want. You may not see anything, but yes, I'm on TikTok. So is Nola the nurse. She has something on there. We're trying to figure it out. Lord have mercy. Yeah,
that is the way.
I'm working with my daughter on TikTok. But as Dr. Lawson said, you can slide in my DM, as many have done. And I try to get back to you as soon as possible. I just say keep pushing, and dream out loud. As Dr. Lawson said, you have to dream out loud. You have to follow your dream. Trust yourself.
Yep.
Trust yourself.
Just do it. At some point, a lot of times I think a lot of people stop and say, well, I don't know what to do. I'm not sure. So, you just can't stop and just keep talking about it. Keep, talking to different people who you feel can help you. And just keep going. I don't think that I'm halfway where I am today because I said, well, I'm just going to stop and sit here and figure it out. No, I just kept going. I know I don't know how to animate, but I said I know how to research people who know how to animate. And then I can always give good direction because, I still have my big old mouth. So I can talk to anybody and say, hey, this is how this is going to go. This is how this is not going to go. We can always talk. So just keep talking until you figure it out.
Yeah, it's like Nike, just do it.
That's it.
There you go.
Do it.
Well, thank you, Dr. Lawson and Dr. Hicks. Thank you to our viewers. Thank you to Nurses Care Hub for allowing us another platform for very impactful and authentic conversations, unscripted, with powerhouse nurse practitioners at the national level. So thank you all for joining us, and we will see you another time. Happy New Year.
Happy New Year.